Hi, so yes, I did my research study on enhancing chronic kidney disease awareness through risk perception in Memphis, Tennessee. My name is also again Phazsa Harris, and I'm a junior at LeMoyne-Owen College. So my reasoning and hypothesis, why do I want to enhance chronic kidney disease awareness in Memphis, Tennessee? Individuals living in Memphis, Tennessee have a higher risk of developing chronic kidney disease due to socioeconomic and historical inequities, like food deserts and really inaccess to healthy food, which is the same thing in like impoverished or low income areas. With chronic kidney disease and end-stage renal disease disproportionately affecting the residents of Memphis compared to other areas in the state, it's necessary that the risk factors are addressed here. And my hypothesis was that undergraduate students and community members who participate in the educational intervention session will demonstrate improved knowledge and understanding of chronic kidney disease severity to enhance awareness. Methods and procedures. So the main method that I used to get the word out about the educational intervention was I used flyers and I promoted basically like having food available and refreshments and some incentives for the participants. Um, and we also conducted a risk communication workshop, which was during the educational intervention. We used pre and post survey for the participants to gauge their knowledge beforehand of chronic kidney disease and post survey for afterward, to see how to gauge the knowledge that they gained from the intervention. And just to delve into the community intervention a little bit more, here I have some pictures of like prizes and gifts that were available. Because I used a interactive game, like Jeopardy, that I had created online to increase memorization for the participants, just to get them really like get their mind really going and their memorization. Because I really wanted this to stick for them to remember, and I have refreshments for them once again. And for the results for the study, enhancing chronic kidney disease awareness pre and post, the awareness of risk factors, which these numbers are from combined questions on each survey of the risk factors and the genetic risk, which I really wanted to highlight during this study, increased from 61.5% to 83.3% pre and post. And then for the genetic risk understanding, um, really like the APOL1 gene, which is a non-modifiable factor, it was very low at 7.7%, and then it increased to 38.9%. And also to touch on some of the recent advances in chronic kidney disease, um, we have clinical trials for pig to human kidney transplantation, which is also known as xenotransplantation. Um, and this is according to the National Kidney Foundation, just to try to combat um, some of the unavailability that comes with needing organs. Sometimes it's very hard to find a match or people that are willing to donate. And then the FDA also approved Ozempic for type 2 diabetes and chronic kidney disease. And some of the limitations are that we are still in the trial phase for xenotransplantation. So it's not really fully a thing yet, but we are hoping that, we are able to grow those organs through a pig. And for the future directions, I have plans to scale up the educational intervention through community outreach. Basically just getting the word out more about non-modifiable and modifiable risk factors for chronic kidney disease. And partnering with GlomCon because I was able to network with some people to bring testing and screening to Memphis and Shelby County community for chronic kidney disease, to basically get the students or the community members to see if they have a higher susceptibility to it, to chronic kidney disease. The goal is to bring more awareness to the Memphis community about a higher susceptibility, which is a higher chance of getting chronic kidney disease because of genetic and lifestyle factors. I want to acknowledge the Shelby County Health Department, Meharry Medical College, the HBCU Wellness Project, Dr. Washington, Dr. Williams, Ms. Small. They have all been very helpful on this project.